had top surgery back in April of 2025 and started coming to see you, I believe, right at the 6-week mark. Now, that had been at the recommendation of my primary care physician at All Brains Belong. They work a lot with trans folks in various stages of medical, surgical sort of transition, and I'd learned from them and from other mask friends of mine how important some form of PT or some form of scar work is after surgery. So right after surgery, I was really aware of how much my mobility was limited because of the scars, because not even necessarily because of pain at that point, but just due to the tissues really gripping onto each other and limiting my range of movement. So that you not only came recommended by my PCP, but also have on your website your talk specifically about scar work, about working with the tissues to help them release, was what led me to reaching out and make an appointment. So it's not that I wasn't expecting to see such a response so much as I went in a blank slate and was left open to be completely surprised by how quickly my scar tissue softened and opened up from the first session with you. You would work on the individual scar line for a bit, giving me a chance to touch the scars before and after, compare the side you'd worked on to the side you hadn't, and even just 20 minutes of work on that first day, there was a palpable difference in the softness of the side you had worked on versus the side you hadn't yet.
It's always great to hear.
It definitely brought a lot of physical ease. I had mentioned tension and tightness, discomfort, and the work we did together absolutely eased that. After we had done the first session beyond the lines of the scars and over the pecs to open that up, I noticed a deflattening of the space of that tissue kind of plumping up into a more comfortable, natural tissue shape, and that both physically and my sense of relationship with gender as shows up in my body. That was a really good session. That felt really good to walk out of there and to both feel and see more curve to the shape after your work had helped relieve the tissue to rest in a more natural space. Of course, you will have less pain and stiffness overall if you get it done closer to the creation of the scarring, but my understanding is no scar is too old to be worked on. There is always more space to coax the tissue into. So even for folks who had gotten their surgery last year or 5 years ago, if they're still feeling some kind of disconnect or some kind of tension, I would say it's absolutely not too late to go in and help your scar tissue release.